One unassuming church, one big community outbreak.
We thought we were safe up till last week.
30 people connected with this southwestern Ontario parish tested positive for COVID. More than 200 are now in isolation. Yet Premier Doug Ford has been hinting at a slightly more rosy future.
The good news is we're seeing a little bit of a decline.
Well, perhaps not a decline, but more of a slow growth, at least according to an analysis from the province released today.
We're estimating sort of a steady state level of cases for a while of between 800 to 1,200 cases. What I think is important here, though, is that although cases are continuing to grow, that growth has slowed and we're starting to see a more gentle curve there.
That gentle curve means ICUs won't buckle under the second wave. The data also reveals personal care homes continue to be a major source of outbreak.
So what that means is we really should be moving to having an approach of testing everyone who works in a long-term care home twice a week. That's not happening right now.
Positive cases remain high. Testing capacity still doesn't meet the province's own targets. And in the last week, there have been 119 new outbreaks, including a wedding in Vaughan, which resulted in 44 cases, which spread to 6 regions. Why then the cautious optimism from the Premier?
When you don't give me the end game, any sense of positivity, that's where we get in trouble.
This communications expert says faced with bleak facts, people get overwhelmed and lose trust in politicians and public health measures.
And I think that's the state we're at right now, and why we're starting to see some more positivity being woven into some of the message, just to let people know, stay the course. There is a silver lining at the end.
Despite some skepticism, there does seem to be a silver lining. Today's numbers suggest that this second wave could be less statistically brutal than originally thought. Katie Nicholson, CBC News, Toronto.